Hi class, welcome. My name is Dr. Kennedy Paron, and today we'll be discussing Chapter 2, Lesson 5, Infertility and Assisted Reproductive Technologies. So we will be discussing first fertility issues. So unfortunately, 1 out of 6 couples will experience infertility issues, and 40% of the time this is actually due to the male partner. So about 60% of the time it is due to the female partner, but 40% it is male infertility issues. So what exactly is infertility? So infertility are issues that lead to not being able to produce children or having a hard time in producing children. Some causes in men of infertility could be misshapen sperm or sperm that have a differing shape than common men's sperm. Also low sperm count, so having less sperm than the typical man. Another one would be STIs or sexually transmitted infections. Some of those actually lead to infertility. Injuries to the testes, chronic illness such as cancer, or even low sperm mobility. So this would be having proper sperm, but they're not able to move or swim as fast as others would. So some common infertility issues in women, this could be irregular ovulation patterns, decreased hormones, not having enough estrogen or progesterone. There are also some conditions that lead to this, such as PCOS or endometriosis, which lead to inflammation of female organs that produce children. PCOS is polycystic ovarian syndrome, so having many cysts in your ovaries, leading to infrequent or no ovulation. And then finally, infections and diseases can sometimes impact the reproductive tract in a negative way through causing inflammation or swelling. So people with infertility issues can be helped through artificial insemination, so bringing the sperm into the reproductive tract of the woman, in vitro fertilization, or using a dish in order to combine the sperm and ovum inside the lab and then putting it inside the woman. Donor IVF, so using a donated embryo and putting it in the woman. An embryonic transplant, so utilizing the creation of an embryo in a lab and then transplanting it into the woman. Finally, we have 2 other methods, surrogacy, so that would be utilizing a woman that is not part of the partnership of the couple in order to carry the baby. And this could be utilizing the sperm and ovum of the couple, or donated ovum or donated sperm. And then finally, adoption. So adoption is legally putting a child in your family that is not biologically yours. So there are many different means of family creation. So people who are infertile have many different avenues in which to introduce a family into their lives. And there's no wrong way.